Hi, John here at Innovative Physical Therapy in Palm Valley. Today I'm excited for two things. I'm going to share 3 tips for improving your shoulder health, and I'm going to do that on location. Today we're going to go to Burn Boot Camp over in Nocti. And we have a few clients that train there that we see here, and I heard good stories about the facility. It's a great training facility with a good vibe and good energy, and apparently a great sense of community. So really excited for that. So who am I, you ask? What do we do here? So I'm a physical therapist, and we have a clinic that is a concierge type of physical therapy clinic. You don't need insurance, you don't need a referral from a doctor. What we do here, we try to help people live their best life. Do the things that they love most in life. Whether that is playing with their grandkids, being able to be on the floor with their grandkids, to play golf, to pickleball, to do workouts at Burn Boot Camp. Some examples from just this week. For instance, I had a 61-year-old man, avid golf player, skier, hiker, likes to go 15 days a year to Colorado and ski. He was already in his mind, and he actually told me he's ready to start giving up skiing and hiking, but he does want to play golf into his 80s, is what he told me. That's his goal. I did his evaluation, his treatment. I found that I could really help him a lot. So I told him, maybe you don't have to choose. How about if we just try and keep you going with all those 3 things, because you love all those 3 things. So he just put out his hand and said, deal, we'll do that. Another client this week, a mom who is my client, brought in her teenage son, football player. He had a fall, broke his wrist, 6 weeks in a cast. She said, John, I want you to check him out, make sure he's moving optimally and there's not going to be any issues down the line, whether it is his wrist, arm, shoulder. So of course we were able to do that quite rapidly for him. And then we keep people going, just like we have a few members that do go to Burn Boot Camp, and they say it keeps them sane. They have a very hectic family life. They want to be able to work out 2, 3, 4 times a week, intense, like you guys do at Burn. And they say with my help they're able to do that. So that's the sort of stuff we do here. So I'm excited to go and see the facility. Come on, let's go. Hey, here we are, Burn Boot Camp, and I'm here with Caroline. Caroline, what do you do here?
Hi everyone, it's Caroline from Burn Boot Camp Ponte Vedra. You'll see me here at the front desk, so I'm here to welcome you in. Right now we have a 7-day free trial available for anybody that is new and local. So come sweat with us. It's 45-minute workouts. We do cardio, strength, all different types of workouts, and you'll never see the same workout twice. We have 10 camps per day, and 5 of those have complimentary child watch. So come join us, and we can't wait to meet you.
Okay, so I promised I was going to show some tips for people that have a sore shoulder, how to know whether you have a shoulder that needs attention or just a little bit of stretching, or a shoulder that needs maybe some professional attention, like what I could do for you. So there's a few things you could check. One of the first things I like to check is, how does your arm move up compared to the other one? So Caroline, can you demonstrate that for me one at a time? Okay, so how close can you get to your ear with your biceps, let's say? So nice and close, and then do the other one. Okay, is there a difference between the 2? Not too much, I would say. Okay, just observing. If you look at I can do this one better. This one is about there. You can see this one is not getting as far. So I got old shoulders, and I probably need some attention there. The next test would be, how well can you go across your body this way? So can you bring your arm all the way flat against your chest, basically? Your right arm, you can do it. Good. Can you do it on the left? Okay, so Still good. She's scoring 2 out of 2. She's passing. I'm not. Okay, so then just kind of go over your pec muscle towards your shoulder, and then you feel the bone on top here, your AC joint, your clavicle, and then feel how prominent that is, and then do the other side. Okay, and I can feel my left shoulder, the head of the humerus, the ball and socket is more forward on this side. This one is flatter, so again, negative score on that one. How about you?
I think the same.
Good.
Not so much difference.
She's the perfect specimen. I don't have to work on her at all. She just needs to maintain herself with maybe after a heavy workout, she gets a little sore. You can get into trouble if you leave the soreness for too long and make yourself stiff. So there's some stretches you can do. Okay, these 3 tips I'm going to give you are all going to help with the things you already found. So if you're anterior here, you don't have very much motion here, or there's a difference between this one and that one, these 3 tips should help with that. If they don't, then maybe you need some intervention, somebody to bring it into alignment for you. Number 1, if you have access to a bar like this, and if you're a member here, you do, get yourself in a position, and I'm tall enough to reach this, and my feet are still on the floor. So I can do this with just the weight that I need, or that I can tolerate, and it should be very well tolerable. Okay, so if you have a sore shoulder, you only go down and bring the hand to a level that you're still very comfortable. Then you go and try and hold it for time. So you try to do this for 1 minute. So I won't keep doing that for 1 minute, but eventually you do less and less weight on your legs until you can do it with your feet off the floor. And the final progression is a more dynamic stretch. It's where you turn your body one way and turn your body the other way during that 1 minute of hang. And you can go even longer as you progress. And you could probably tell that these muscles here were stretching. I would feel a good stretch. Okay, tip number 2. You have one arm that doesn't go very well this way. I can feel this one is not. So we're going to do a contract, relax type of technique. Meaning we're going to go to a spot where I can feel no discomfort, but a little bit of stretch. I feel like I'm close to the end of my ability to cross body. I put my hand on my shoulder so I can relax it. I put my other hand supporting it, but also in a position to resist. So now I'm going to push with this elbow into my hand. So if my hand wasn't going to be there, my arm would do this. So I'm pushing, 1, 2, 3, 4, 5, relax. And then gently bring it an inch further. Push again, 5, relax. Bring it a little further. Do about 3 times. Now I'm going to have to keep my arm here. So I'm going to use the opposite muscles. So I'm going to pull with this hand this way. I get my fingers off my shoulder because that would be too easy. And I'm letting my muscles keep working to stay there. Relax, 5 seconds. And then do it again. Hold, hold, hold. Good. Now we're going to do the active push until about here. Resist as far as you can go. Push. Resist as far as you can go. Third one, push. And then as far as you can go. How did that work out for you?
It felt good.
Okay, then go again. Do the one that you didn't do yet and compare it to this one. Okay, now I actually have better motion in this one than I have in this one. So it actually flipped, so I would want to do this one next. Okay, tip number 3, if you have access to, this is a rumble roller, or if you have any regular foam roller, I prefer this one because it's got the knobs and goes nicely into the muscles. So this puts an extra emphasis on the target muscles that you're trying to stretch, which could be the teres minor, posterior delt, some of the trapezius, the subscapular, and even the latissimus. So what you want to do, find a spot where you can do this on. I don't recommend doing it flat on the floor because you might put too much of your body weight pressure on the shoulder, and then it doesn't become a relaxing type of stretch. Target area would be here, here, and here. Maybe even a little bit in the posterior delt. So here, here, and here. You drape yourself over this, kind of like you're having your arm raised up like this. Wherever you're comfortable. If this is all you got, this is your restricted arm, you can only go this far, then that's where you stay when you're here, and then you want to be able to rest it. So you find yourself a spot. You can do a couple of things here. You can just do this, and that action already creates a little bit of focus on that stretch. You can then go a little bit into this positioning, and then the third option, move the whole roller around so you get different fibers stretching. Okay, so a combination of those three motions, here, 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 with enough time, will give you the focus and then the lengthening of the muscles here. And then test again, see if you got better motion than before. And actually, both my shoulders are working a little better. All right, guys, I'm putting in a little bit more reps, and Caroline is putting me through the ringer. I want to say thank you, Caroline, for your hospitality. Beautiful facility here at Burn Boot Camp. Feeling the pump. My shoulders are in great shape. If you have any issues with your shoulder and want somebody like me to take a look at it and screen for issues that might need some attention, we do offer free discovery visits. You can just come by and we take a look at you and see if we are a good candidate for us to work on you. And that can be shoulder related, it can be hip, it can be low back. We treat the whole body. Feeling it yet?
Yeah.
We'll keep going. And the other thing I want to say is at some point we'll work together with Burn Boot Camp and we'll do a screening here on site at some point in the future. We're working on that. Thank you very much.
Thanks, guys.